We want to talk to Henry Coburn, who's been covering a surge in cases in Lawrence County. So Henry, how's it gotten so bad there in Lawrence?
Well, Ben, here in Lawrence, you know, the National Guard was recently brought in, medics from the National Guard, to help with the hospitals that they say they've become inundated with the surge in coronavirus cases. Whether you've been practicing good habits from the beginning of the pandemic.
We stayed home a lot. We spent a lot of time at home. We do have our little COVID bubble, which I have a family, a brother and a sister, and my parents, and we've kind of stayed together and not really gone anywhere.
Or you have yet to start. Many are scared.
COVID is real, and I'm here to tell you, I was the first one to think that it wasn't. It was government controlled. The government's trying to control us, but when it hits home and it hits a loved one, it is real. Worry
is growing among local government leaders as case counts continue to climb.
This is the situation we're now dealing with, and we don't have any margin for error right now.
Lawrence Mayor Nathan Sin says local hospitals are running out of room. South Carolina DHEC shows that the hospital occupancy rate for the county is 64%, with 64 new reported cases on Sunday and 1 death blamed on the virus. That brings the county's total COVID-19 deaths to 93, with another 3 deaths being probable. At Lawrence Hospital, the 3rd floor has been converted to a surge area for COVID-19 patients to provide 29 extra beds.
Hospitals are used for all sorts of other things other than treating COVID-19, and so the problem is if we max out our hospital facility and we don't have beds available, if you have a non-COVID related emergency or illness, if we can't guarantee a bed, that puts us in a very, very dangerous situation.
Prisma and local leaders are working to set up a COVID-19 convalescent unit in the next week. It is slated to open January 18th with 15 beds. Prisma says it will be staffed both by National Guardsmen and staff from State Emergency Management. Now, hospital leaders and local officials are urging you to help flatten the curve. They say to do that, the best things to do are the things we've been told to do all along, like washing our hands, wearing a mask, and of course, socially distancing. Live in Lawrence County, Henry Coburn, 7 News.